Awesome. Well, welcome everyone. I'm Cindy Lupi. I'm part of Winthrop Mothers Out Front and Friends of Belle Isle Marsh, and I'm the New England Director for Clean Water Action. And I'm thrilled to be here tonight to have this conversation with you and with Lane about air quality and our health, and critically how this intersects with justice issues. I wanted to frame all this work by letting people know that Green Roots, the group that Lane works with, and Clean Water Action are part of the Environmental Justice Table. That's a name for a coalition. I know sometimes people are like, table, what's a table? Well, it's essentially a coalition of groups that are focused on reducing health burdens and environmental burdens for the most at-risk communities in the state. Communities that are by definition low-income, BIPOC communities, language isolated, meaning that lots of residents don't speak English as their first language. And I think we all know that historically, those are the communities that have been particularly overburdened with pollution and health. So there's a justice imperative that we work to make sure that the most overburdened and underprotected are lifted up. So this is the work of the EJ table. We worked together early on last session to successfully update the state's environmental justice requirements. And excitingly, that includes new requirements to assess cumulative impacts of pollution in a community if there's a polluting facility that's being proposed. And the goal of this, the bottom line, if you remember nothing else from tonight, think that Massachusetts has new tools to make sure that we don't add to burdens of what we often refer to as hotspot communities where pollution is centered, and that we can actually start reducing burdens. So from a justice perspective, from an equity perspective, this is a really exciting advance. And we're only the second state after New Jersey to adopt this process. So we're at the front end of this charge, and that feels really good. So these are just a set of the groups that work together. It's led by groups like Neighbor to Neighbor and Green Roots and the Coalition for Social Justice, Alternatives for Community and Environment. So the leadership of the justice communities is in the steering committee, and all of us together support that vision. So I don't know, have any of you heard the saying, not about us, without us? That is one of the principles of environmental justice, and it means that community residents are at the center of leadership of these kinds of efforts. So there's a real integrity to this process, which is great. So that's just a little bit about the EJ table. After having passed that really exciting reform, there's a couple of top priorities that focus in on air pollution and on the siting of energy facilities, which are among the biggest air polluters and water polluters in the state. So that's a little bit more of what we're going to talk about. And to help bring some perspective to this, a number of us worked with the Boston College School of Public Health and Dr. Philip Landrigan, who is a national and international expert on air pollution and actually all kinds of environmental health threats and problems associated with pollution. And this past July, he released a study that he and a number of his colleagues worked on that found, I don't know if any of you saw this headline. I think this was from the Herald. Air pollution is killing nearly 3,000 people in Massachusetts every year, study finds. So that's what his research looked at. He looked at concentrations of pollution and then modeled out where we have epidemiological studies, many of them pioneered here in Massachusetts at Harvard, and looked at the findings of those studies that link up with different concentrations of pollution. So can you put the next slide? And one of the center points for this research is what we've actually just been talking about, that air pollution is not evenly distributed and it can be heavily concentrated in communities like Chelsea. So, Lane, is that a good Chelsea picture?
Yeah. Chelsea.
So we know that a community like Chelsea is right next to the Tobin Bridge, huge traffic source, historic pollution levels. Also, did any of you see the headlines this past year about asbestos contaminated debris that was trucked in from Salem and dumped in Chelsea? What sadly we know as neighbors to Chelsea is that the truisms around environmental justice play out, and that Chelsea continues to battle too many burdens on the environmental health front. So, it's part of why we're so grateful to have Lane here, because he has really been a big part of gathering the community to focus on determining what the problems are and then building political will to fight for the solutions. And that plays out broadly across the state. Environmental justice communities are overburdened, and it's also true that there are barriers or boundaries between a community like Chelsea, East Boston, Revere, Winthrop. Air pollution flows amongst and between all of these communities, and we all know what the sources are broadly in our communities. This is what the study found based on 2019 data, the health effects across the state were. So every community has impacts, and some of the most intense impacts were centered in communities like Chelsea. So I don't know if anyone has questions about any of these particular health impacts. I think we're used to thinking about lung issues with air pollution, but there are others as well.
What year was it?
Statewide?
This is statewide, and it's based on 2019 emissions data.
I'm curious how they got the data about the IQ points in children.
Such a good question. So as I was saying, we're used to thinking about cardiovascular, lung impacts, asthma attacks, emergency room visits, breathing problems. Awful. Like, there's nothing worse than, does anyone here have people in their lives who have asthma or respiratory problems? What does it feel like to be next to someone struggling to breathe? Yeah, it's terrifying. It's the scariest place to be, like to be helpless when someone's literally struggling to breathe. It's really frustrating. So these are significant issues. There's additional studies that have looked at other health impacts related to air pollution that are more systemic in the body. So thinking about the connections between pregnant women and impacts on developing fetuses. Low birth weights, there have been a number of studies that make those correlations between higher and higher pollution levels and birth impacts. And these numbers, I should flag, are based on what's called ultra-fine particulates. Fine particulates.
Yeah.
Fine particulates. 2.5 microns. So they're invisible to the human eye. They could fit several, like hundreds of them on the head of a pin. So we can't see them, but they have the ability to get past our body's defenses and lodge deep in our lungs and then kind of disperse through the body. So that is part of how they affect more than our lungs. And research is starting to uncover that. Barbara?
I didn't understand the answer to the question about the IQ point.
I'm getting there. It's not quite there yet. So there have also been studies that link up concentrations of pollution levels and impacts on children's brains. So this again is looking at concentrations of particulate matter, 2.5, and impacts on the brain of young children. So what the study found is that In Massachusetts, this also holds out. We'll see when we look into the Winthrop and Chelsea numbers a little bit more fine-grained and look at the local impacts, that for most children, it's 2 or 3 IQ points. But overall, it's actually a really big toll on our state. So, next slide. Who here lives in this community, lives in Chelsea, and can answer this? About 2/3 of the pollution that we experience comes from what? Transportation, airplanes, buses, trains, ships, obviously other smokestacks like the trash incinerator in Saugus. Traffic issues. Who here experiences traffic going in or out of Boston through the tunnel? The Tobin Bridge. What do our local roads feel like to you all? Say at rush hour. Gridlock. Right. So when cars are stopped, when vehicles are stopped, they're still emitting particulate matter and other emissions. So these are the majority at this point of our pollutants, but power plants, residential heating and cooking, other industrial facilities are also responsible for a chunk. And this is the good news part of our presentation, because this used to be much more equal. But all of the coal-fired power plants, the old facilities that are were kind of Eisenhower era coal plants, have been shut down, and we're transitioning towards other cleaner sources. So that's actually a bright spot for Massachusetts in air pollution levels. This is sort of an overall concentration of particulate matter across the state that the study used. So, again, this is 2019 emissions data and concentrations of particulate matter. And where do we all live? Which county? What looks most bright red to you? Suffolk. Yeah, so we're a little bit in the eye of the storm here, which is why this is such an important issue for our region. These are this is the representation of the emissions that this study is based on. So we have some concentrated pollution issues to handle. Barbara?
Does it look like Berkshire County is more polluted than, for instance, Worcester County?
Yes. Who has an idea why?
On average, because there's probably a center in Worcester.
No, it's the industry that's out there in Pittsfield.
It's so wind in general in the country flows west to east and up the Atlantic seaboard. So again, air pollution doesn't stop at the state border. There's a chunk of New York's pollution that people in Western Mass are impacted by. And that's the major source of some of those issues. In days past, there was a big coal plant in Holyoke, the Mount Tom plant that's no longer there. That's more good news. But yeah, a lot of the Western Mass pollution comes from what they call interstate transport of emissions. It's just a big, unfortunately, conveyor belt that goes up the Atlantic seaboard. And it's part of why our New England governors and legislators have been interested in really attacking this, because if we can get a handle on our in-state sources, then it's called the clean hands theory. With clean hands and moral authority, we can look to downwind states and say, it's your turn. It's your turn to also make improvements. So digging deep into this report, one of the things that's very exciting is that online, and we'll include the link to the study in the next slide, you can click on your community and a reading comes up of what the actual pollution levels and health impacts the study found and confirmed are. So, some of this is population-based. You can see Winthrop's population. Winthrop is way fewer people than Chelsea, it turns out. I hadn't quite realized that, Lane. In general, our annual concentrations hover around the 7.57 micrograms per
Yeah,
meter
something
cubed,
cubed,
thank
yes.
you. And that is much less than it has been in the past. And it's also just under EPA standards for ambient air quality. However, we still have these health impacts. Who here thinks these health impacts from air pollution are acceptable for our communities? I don't see any hands. I don't either.
And what
Donna.
period of time is this?
Okay, so this is an annual
Annual
assessment, and it's
yeah.
based on 2019 pollution levels. Were we in the middle of COVID in 2019? No. So, there will be fluctuations year to year based on, based on what emissions and particularly how many of us are in cars and vehicles look like. But this is a snapshot of an annual impact from air pollution, from this one air pollutant, from particulate matter, PM 2.5 in the state. And next up, we have Chelsea. So, this, by the way, is the link to the study. For those who are interested, or, I see Sonia here, and Yay, and other friends from East Boston too. It's so good. East Boston in the house. Boston is represented in the study, but I didn't see a breakout for East Boston, so that's unfortunate. But it is still true that Boston and Suffolk County, Chelsea, Winthrop, the communities that you're looking at for resiliency are in the eye of the storm. And interesting, more than, or just about double the population in Chelsea. So interesting stats. Another thing to flag here, which is part of, I think, our agenda for change. There are so few air pollution monitors in this region monitoring PM 2.5 that even though at lung levels in different neighborhoods in our communities, pollution levels will vary, we only get one reading. So that's part of why there's a big move to get a lot more air pollution monitors set up, particularly in hotspot communities like in our region. I feel that we are seeing a big influx in this discussion in part because there's a big national focus as part of different funding packages to invest in more air monitors and also more air filtration, which is another piece that we'll get to. So in Massachusetts, the EJ table actually has a proposal pending with EPA that could result in several dozen more air pollution monitors moving out in the most hard-hit EJ communities, which is exciting. The state DEP also has a proposal pending that would give the state more resources. Very exciting. The city of Boston also very engaged in an ongoing way. So there's, to your point, we're at an exciting moment in this battle because the resources are flowing in to really get more information. And I emphasize at lung level. I think we all are familiar with the air patterns in our neighborhood. And one centralized air monitor that's maybe closer to a highway, farther away from a highway, closer to the airport, farther away from the airport, at a higher elevation, at a lower elevation, like all of this can matter. So getting more information in this case will be really helpful for us to better define the baseline of our current pollution levels and the hardest hit neighborhoods that need the most help. Donna, then Barbara.
No, go ahead.
Oh, no, Donna, then Jeff.
Okay.
Jeff, then Barbara.
That was the crux of the question I was going to ask was about this air pollution monitoring. You read in the Winthrop Sun transcript from the Boston Globe that they're going to use these air pollution monitors. And I wondered what is the status of all that? Now you say, and because you need the data, it has to be data driven to make for a positive change and make for all the good things that we talked about earlier. But you said, I mean, one for one area? I mean, Suffolk County or, you serious? I mean, the way it's written up in the paper, it's like I could call a number and say, yeah, put one in my backyard kind of thing, but it's obviously not the case.
It's not the case. There are very few,
Where
there's
are
something like
they?
13 stationary air monitors across the state
Is
that
that
are
right?
Yeah.
monitored by the
EPA.
Department of Environmental Protection and EPA.
Huh. And how many in Suffolk County, do we know?
Chelsea's got one.
Yeah.
I-
I think
I don't
you're,
think those, I think it, is there one in East Boston?
No, I don't, for East Boston, the closest one is in Nubian Square, which is.
that's
off the
newly,
harbor.
and that, the Nubian Square installation is very new, and there's a new installation in Chelsea as well.
At Highland Park.
Okay, so there's one in Chelsea and.
Nubian Square.
In
Where is
Roxbury.
Nubian
In
Square?
Roxbury.
It's
In
on
Roxbury, okay, sorry,
Um,
thank you.
Yeah.
And the one in Chelsea is very limited.
Uh-huh.
So it only does fine particulate matter, whereas there's others that get ultra fine particulate matter, which is an even smaller particle than fine particulate matter, and black carbon, so direct emissions from semi-trucks and freights, and
Diesel pollution.
yes, and there's others, but the one in Chelsea only has particulate matter. So it's not that,
All inclusive.
yes.
Yeah, so we are
Thanks.
limited in
Yeah.
in
That was
our collection of this information a
Yeah.
bit, but it's about to break open. Representative?
You just added a question for me. So Massport, we know, has air quality test monitor devices in Winthrop and Revere. Do they share that information with you? And is that, if they don't, would it be helpful to you, Lane, if you could get that? They typically take the position they only have raw data because they're waiting for 50 years to finally look at it. But, I'm being facetious, but they, when you ask for the data, they say they still haven't calculated. Would that raw data help you? Do you know what they're doing in Winthrop and Revere?
I personally have never seen that data. I know folks at Greenroots have asked, and then they get that explanation, oh, we're working on the raw data. We're gonna create an image for y'all. So I don't know if we've seen it.
We can circle around offline on that because that might be something. Two other things on the charts comparing Winthrop and Chelsea. I think you said the 7.57 is below the EPA level.
Yes.
Which is surprising, seeing the earlier graph that showed us bright red. So
Well,
how do you
here's-
reconcile that?
It's such a good question.
And one other thing, if I could,
Uh-huh.
how do you reconcile, I'm fascinated by the fact that Chelsea is more than 2 times the size of Winthrop, but their numbers, other than pediatric asthma and the low birth rate, they don't seem to correlate for our size versus their size.
Yeah, I kind of wish we had Dr. Landrigan here because I feel like he would be able to nail that response.
Yeah, I'm
But the
just,
first part of the question is very answerable. So the standards that we were talking about in terms of being in compliance are for the National Ambient Air Quality Standards for particulate matter. That is set through a political process at the national level by EPA, and it's revisited every handful of years. Like, it's supposed to be revisited every 5 years. It doesn't often get revisited every 5 years. But what happens is there's a political argument in a public space, in a public hearing process, about what are acceptable health impacts from air pollution levels. And then that whole process drives, I'm trying to summarize here in ways that, so Lane, if you have thoughts on this, also chime right in. That process of setting what standards are acceptable at the national level according to EPA and their scientists and their processes and the political waters that get us to a number, what this is showing is that this level of health impact exists with an area that is in compliance for EPA National Ambient Air Quality Standards. So a little bit of what we're doing here in Massachusetts is familiarizing ourselves with air pollution levels in our communities and pushing for better. Pushing for better. And also pushing for other interventions like East Boston and around the airport. Communities have been really wonderfully persistent in pushing for air filters and, you know,
The windows.
the windows and getting buildings to be safer, because that's the other thing about outdoor air pollution. Does it stay outside? No, it also comes inside. So we're concerned about indoor air quality based on a few factors, plus the outdoor air pollution coming into our buildings. Sonia?
I know we do know that 70% of that outdoor pollution makes it inside, so.
Yeah.
I wanted to say that I don't think the Massport related sensors, because they're EPA sensors, measure ultrafines.
I think
So-
they're already limited.
Very
as
few
well.
measure ultrafines. Ultrafine particles, which are 0.1 microns per cubic meter. Very small, even teenier than the 2.5, PM 2.5. This is sort of emerging science, which we're going to get to. So hang on for just a second about the ultrafine. There are some monitors that are in place in our area that do also monitor ultrafines. But in general, the bottom line is we're working to get more of them, because we need to know, and we need to have a better sense of the baseline so we know what success looks like. We need to bring our vision together. Okay, if our pollution levels are here, what are we going to come together with scientists and physicians and health professionals, you know, pediatric nurses, all of us together as communities deciding how to drive down these emissions and how to get better protections in buildings with vulnerable populations like schools, like senior centers. So, Barbara.
During COVID, there was a big push to get better air quality into the schools and put in air filters and all. Did that impact any
Helped.
of this? It
Definitely
did.
helped.
Right.
Wearing masks also helped, interestingly. Our asthma attack numbers are down through some of the COVID years because of these interventions.
Well, that's good government
Okay,
incentive.
one question here and then here.
Let me
Oh,
finish my
okay.
answer.
I'm sorry, more questions from Barbara.
You said it was the EPA standards that you're going by. Is that the standard that the Supreme Court just shot down? Because it was the EPA that got shot.
I believe these standards are fine. With the standards,
For the moment.
for the moment, the standards I'm most worried about that are being considered right now are the Clean Water Act standards under Supreme Court supervision, examination.
If I can too.
Yeah.
The EPA standards are also different than the WHO standards.
Yes.
The WHO standards are actually much lower.
Much more stringent.
So the standards that Chelsea and Winthrop have are above the WHO standards.
Yes,
which-
well said.
Folks are trying to understand is that exposure to higher levels from WHO causing these early onset dementia, low IQ points in youth, higher asthma rates, higher cardiovascular problems, and higher pulmonary problems as well.
Does everybody know what the WHO, or who the WHO is?
The
World Health Organization. Yeah, so there's some international standards that one could say are maybe a little more objective around defining air quality standards. EPA's process is a little more political, but it's also very true that every pollution reduction that we make is good for our health, and this region has experienced some big pollution reductions. So it's getting better, it's just not where it needs to be yet, and particularly so in overburdened communities. So this part of why we're also really interested in getting more monitoring of the ultrafine particles, as we've been talking about. This is straight out of an epidemiological article that I was reading. So I'm going to kind of try to bring this down to more English or more basic health terms. So we're really concerned about these particles because they lodge so deeply in our bodies, and our body's defenses cannot fight them off. So that's what this means. It's a component of air pollution. It gets right into our respiratory system, and they have determined that there are links to genotoxicity, genetic impacts, birth defects, to neurotoxicity, a little bit about what we've talking about with sort of brain impacts, both lost IQ, developmental delays, early onset dementia, cardiovascular diseases and cancer, I think we're generally familiar with. But all of this information is coming together to give us a sharper picture of what our health impacts are. And because of that, we have a little bit of a political moment and some time to come together as a state and work for tougher standards at the state level and an action plan to address this air pollution issue that is expanding all of us, particularly the most vulnerable communities. So, who here, Mothers Out Front was a great ally working on this bill this past session. Who here remembers talking about the Improving Air Quality for Communities Burdened by Transportation Pollution bill? Yay, Sonia, yay, Carol, extra stars. Okay, well this bill it was one of the top 3 priorities of the EJ table, and it was spurred on by a lot of great community leaders in EJ communities and also in Somerville. Why would anyone imagine that the community of Somerville would be really concerned about transportation pollution?
93.
Boom! Gold star, Barbara. Yeah, 93. And the residential neighborhoods on both sides, right there in Somerville. There's been a lot of community action. Same thing in Chelsea, Tobin Bridge, right there, residences right there. Lane, I think we were both on a call with a Chelsea resident and a whole bunch of folks, health professionals, earlier this year because this woman was reporting that there were piles of dust coming in through her windows and accumulating in her yard. She lived pretty near the Tobin, and health professionals were, jumping in to get a finer look at it because that's not normal. That's not normal. I've worked with people who live next to coal plants, and they don't have regular piles of dust accumulating from outside coming in on their windowsills.
I actually, because we're sandwiched here between Massport, Logan Airport, and I live out on Point Shirley, so I have the MWRA facility. I have the tanker trucks go by my house every day, to and from the. I can dust my window ledges tomorrow, and on Saturday morning, I will have a black coating on all of my windowsills.
Yeah.
All of them.
I know, you could write in it.
So it's,
Yeah.
It's an ongoing battle because not only do we have the air pollution, we have noise pollution,
Yeah, and it
which
combines in a
impacts
nasty
your
way.
health as well.
Yeah.
Heart, strokes, stress, all of
Yes.
that.
Yeah,
So
absolutely.
we're kind of dealing, just like with Chelsea and East Boston, we're dealing with it on
Yeah.
2 ends.
We do.
So
Winthrop
sometimes
is
you
definitely
feel like
a
you're
highly
sandwiched
impacted
between
community.
2 boxers going at it with no way out.
Really well said.
Yeah.
Very well said. So let me describe what this bill would do and also give updates. Or Erlene, do you want to?
You can.
Okay. So, Green Roots, Clean Water, a whole bunch of us on the EJ table prioritize this particular bill because it does what we've been talking about. It would establish a baseline through more outdoor air pollution monitoring of what the air pollution burdens are now in more communities. And it would enable us to say definitively which communities are most overburdened. And let's concentrate some resources there to make sure that by 2030 and 2035, what the bill actually says is that there would be first a 50% and then a 70% reduction of air pollution, including ultrafine, black carbon, and fine particulate matter, and nitrogen oxides and other traditional air pollutants. So that's what the bill said. It would require installation of air filters, and it would require advanced filtration systems, which I know our East Boston friends are very familiar with, in what the bill defines as eligible buildings that are in these impacted communities. And you can imagine what those buildings would be. certainly schools, certainly long-term care facilities and hospitals, many of the public buildings in these neighborhoods. It would also, the bill, very excitingly, would also look at indoor air pollution, which includes looking at measures to improve mold accumulation in buildings. And this one is very controversial, but kind of exciting, would look at, for the building code, having advanced building codes not allow gas stoves, because I know some of my friends here know what happens to indoor air pollution with gas stoves, whether they're lit or not.
It increases, I think, in the Scott Hersey study when they were doing air filters. In some cases, when they opened the windows to the outdoors, it became less polluted.
Yeah, it's essentially, bottom line is that gas stoves are a significant source of indoor air pollution. So moving away from gas stoves to convection stoves would be a good thing to do for indoor air pollution. So this is what the bill as written and introduced last year looked like. It got included in the Senate Omnibus Energy Bill, which was very exciting, in kind of a revised format. It called for a lot of this, but it required DEP to make a plan for pollution reductions. It didn't quite lock them into a 70% pollution reduction by 2035. I think it's possible DEP felt that was too aggressive for them to handle. Communities are pushing for that level of relief. We're going to see how this all comes out next year. This bill is going to be refiled. It's going to be revised some based on conversations with the Department of Environmental Protection and also the Department of Public Health, because DPH is more engaged in the mold issues. So it addresses both agencies. So we need to make sure that we have a good team bringing along DEP and DPH as we move this policy forward. But this is going to be a big priority for certainly the environmental justice community, and I think for all of us. Mothers Out Front was wonderfully active in supporting this bill last session, and we're really hoping that next session, we've had some initial discussions on this bill. It advanced significantly. This bill got reported out of favorably the Joint Committee on Public Health in the legislature, and it moved through the Senate and was supported by the Senate in their omnibus bill. So that's decent progress for a first file introduction for a bill. So that's this bill. The other bill that is related here, and Lane, I don't know, do you want to take this one? Because this is so about Chelsea.
I don't necessarily know that much
Okay.
about the bill itself.
Okay.
I can talk about it.
Yeah.
Antonia and Melinda probably know a lot more too, being East Boston friends. So essentially what this is it's supposed to do, for the electricity siting facilities, it's supposed to do an environmental impact report and then also a notification form informing communities about siting new electrical facilities. So in East Boston, the substation that was told that the residents of East Boston were going to have interpretation, community would be able to be engaged in it. However, that wasn't the case. The interpretation was only for the representatives that were there for the siting facility board, which folks were very disappointed and got voted against by the community. The community of East Boston said no to putting it there, but we'll see if it's going to go in. And so this would require that the facility board of this substation would actually have to do an environmental impact report. Being that the electrical substation is next to 8 million gallons of jet fuel for Boston Logan, 80% of the heating fuel for the region, and 70% of the gas for cars. So putting an electrical substation there didn't make sense. It's also in front of a park with a community that already has high amounts of asthma rates, poor air quality because of the tanks, because of the traffic, on the Condor Urban Wild Street area. And so they thought that putting it there would actually be beneficial because they said, oh, you need a substation, but because of East Boston's demographics, it was deemed the best to be put there. So all of this would just essentially say that the process that the EFSB, the Electrical Facility Siting Board, did was unjust, and they would have to actually inform the community of the impacts that it would cause. So would it increase the already poor air pollution in East Boston? Would it increase the water pollution on the Chelsea Creek? There's another thing that I feel like I'm missing, but I can't remember it.
No, you got it. You got it, Lane. Well, one thing that I think would be interesting to note, who is the amazing champion of this bill?
Oh, yeah, right, Monroe.
He was in here tonight, but he's in Italy with his family.
Yeah, well,
He got back to me.
appreciate that leadership so much. So, as we talked about earlier, energy facility siting, big sources of air pollution, tendency for big electrical systems to end up in EJ communities. So what this bill would do would add some specific consideration to public health, environmental justice, climate and resiliency to the siting board's responsibilities, that they can't just consider, is this the right facility, is there need, is there a determination of need, is this the right facility in the right place at the right time? They have to consider other issues and broaden that review. As Lane was saying, there would need to be expanded outreach in the language of the community in advance notice so that residents could get educated about what is potentially coming to their neighborhood. And again, on that cumulative impact theme, excitingly, there would have to be an assessment of the pollution that's already in the neighborhood and that what additional pollution this facility would add to it. And if that impact is deemed too high, then the facility would be denied siting permits. So this is another big priority of the environmental justice table, and Green Roots is our, our heroes and sheroes of the day, because they're really working hard on this issue based on their local experience in East Boston and in our region. Barbara.
Do they take into consideration when they do these studies just East Boston, or would they say, for instance, like a 5-mile radius around the potential site? Because, for instance, Jeffrey's Point wouldn't be as impacted as part of Chelsea.
So with this, and then with the air quality bill that would get passed, that would require that any community within a 5-mile, if it is producing an air pollutant within 5 miles from that point. So they would go out to, if Jeffrey's Point is 5 miles from the electrical siting facility in East Boston, they would do an environmental impact report all the way out there. They would do it to Revere, they would do it to like downtown Boston, they would do it out to Cambridge, to Somerville, to see the impacts of the air pollution.
The
Okay.
air quality bill that we were talking about explicitly allows for what is called participatory community level research. And that's part of why Lane is here and what he's piloting and advancing in Chelsea is a really good model and example of that. The goal with this participatory research is to have local residents and state officials come together around a common understanding of what the problems are, trusting the community level knowledge and expertise of residents who live there, and having that augmented by state officials and some of the experts at universities that we work with. Like the project that we're on pins and needles about, hearing about funding from EPA, would include experts from universities who would help us
Okay.
be able to describe
Okay.
some of the likely health impacts from pollution levels we're seeing. So it's not an either or, Donna, it's a team. The goal of participatory research is to build a team. So Lane, do you want to talk about that more? Because he's the guy.
So I can talk about one of my big projects right now. So we're actually partnering with Boston University, and we're actually looking on the indoor air quality component. And so just a few statistics about Chelsea that haven't been stated. So Chelsea ranks 3rd for asthma hospitalizations in the state of Massachusetts. And during COVID, they had 6 times the rate of infections than the rest of the state. So things like that, folks are wondering, well, why is Chelsea's air quality so poor? And then you have, the Tobin Bridge, where there's 60-something thousand cars pass it daily. Marginal Street, which is a truck route, has 37,000 semi-trucks annually going by it. And then, as we know in Boston Logan, there's like 1,200 flights coming in and out every day. So all those things, when you get those stats, you're like, okay, this is what's happening. What is it like on the experiential level with community members? And so having these high asthma rates, our study is focusing on what is the indoor exposure to fine particulate matters? And does a air filter work as a mitigation tool to lower the exposure to particulate matters? But does that also correlate to a reduction in asthma symptoms? So the primary focus is to see, are we reducing indoor air pollutants at a granular level, at a level that is noticeable, while asking these questions to see, is your health correlated to it? And we are coming to the end of the data collection process. And through asking questions, folks are saying, yes, this feels amazing. However, on paper, I can only see 1 day's worth of data, so I don't know if the levels have dramatically changed. And this is where getting that information out to the community is the most important. So we created a baseline for a month. We put the sensors in a home to see what is it like in your home for the first month. But then we started noticing things like folks have gas stoves, but they don't have a hood fan. So we would notice at like 9 in the morning, 1 in the afternoon, 2 in the afternoon, 7 at night, 8 at night, there's these massive spikes. And we're like, what is happening? And then we kind of thought, okay, maybe they're cooking, but we didn't want to guess. And so we asked them, and they're like, yeah, we're cooking. And we're like, oh, that's an extremely high amount of exposure. So then we thought, should we ask these asthma questions at those times? So we call around noon when they're cooking, and like, over the last month, what are your symptoms like? Like, oh, how many times a night have you, or how many times have you woken up early or in the middle of the night than normal? 4 times a week, once a week, once every 2 weeks? What is it like? And some folks are like, yeah, I wake up every night. And this was at the peak of the summer too. So then they're like, is it because of the heat and the air quality, or is it just because of the air quality in my home? So there's not enough data to say, this is what's in people's homes.
Yeah.
And this is only in 7 people's homes, which isn't enough, right? So it's a very basic entry point, and we need more of it, because folks shouldn't be experiencing shortness of breath in your home 6 times a week, right? So we're trying to learn this stuff so that folks, we can figure out what mitigation methods are there that are actually going to be beneficial to reduce asthma, to reduce COPD, to increase the IQ points that folks are saying their youth are losing, or to prevent this early onset dementia so that folks have a better quality of life that they deserve.
And I also just want to say that the community experience is frankly the part that is usually left out. It's very rare in my experience that there are technical questions in a process that the Department of Environmental Protection runs. Often what's left out is the community expertise at the grassroots level. So what this participatory research is working to do is to get that balance a little more right.
I just wanted to ask and bring up a point about the EPA role in these monitors, because a couple years ago, some of us went to Massport. There were a couple FAA grants put out for airport communities, so we met with Massport and said, we have this data from these Ponte-Q sensors. We have data for years, and these are collecting full pollution profiles, including ultrafines. Here's what the data has told us for years. And they basically said, well, because those aren't EPA certified sensors, they don't have to pay attention to them. So it is a problem, and I wonder, I don't know, like we probably do, the DEP and EPA, how those two
The
merge.
interplay,
Yeah.
it's very based in the Clean Air Act. So there's the National Ambient Air Quality Standards that are set nationally. Then states and state regulators like the DEP have to make state air plans to get in compliance with those national standards. So it's a mix of authority. And DEP is the agency in Massachusetts that is essentially responsible for implementing the state's air quality plan. And so they are the body that we have been working with a lot about this whole question of air monitors, what level of quality is good. There's also, so there are benefits of having more air monitors, even the ones that don't collect very much, for people in the community to just have more information, snapshots in time of what air pollution levels are. Then there's official systems that the DEP is working with to help monitor progress on the state's air quality plan, and if this air quality bill passes, to help establish those credible baselines of air pollution loads and measure success in getting reductions. So you're asking all the right questions, Donna and Sonia, about how this could work. But essentially, it is a mix of EPA and DEP authority. And on the indoor air quality issues, the Department of Public Health also will have to play a role. So there is a likelihood, or a potential, we'll say, that the indoor air quality parts of the air quality bill and the outdoor parts will become two separate bills. That way there would be a little bit more clear separation of authority for each agency. But this is all still being figured out for a January file.
I just a question, was data collected during 2020 during the pandemic?
Yes.
Because I can just speak personally, our air quality in Winthrop, at least where I am, was much better during the pandemic because there were fewer flights going in and out of Logan. And we noticed that we go out for walks in the evening, it was like we didn't have that really strong
Yes.
acrid smell from the jet engine
Yeah.
fuel. And there were fewer cars on the road
Yeah,
because
who here
people
lives
weren't
near the
commuting
airport?
anywhere.
Anybody else live near the airport
Anybody
here?
at Winthrop was through the air.
Yeah, it's true. But did other people kind of experience that during the
You could
pandemic?
just look at the horizon and see the difference.
Less of that haze. Yeah, it's true. It's true. So maybe we should go to the next few slides and then just take additional questions. So this is the bottom line of where we ended up this legislative session. We didn't get any of these bills over the finish line. We're grateful for our champions and for all of our legislators here in the room having this conversation. You have to bring our thanks back to Senator Edwards for sure. And, you know, thank you so much, Rep. Turco, for being here and being part of the conversation. We want to keep really making sure that the most vulnerable communities improve, because the bottom line is if we set standards such that the most overburdened communities see improvements, we all see improvements. All of our air will get cleaner. And we need to keep pushing for justice. This is a core part of what we owe our neighbors and the next generations that are coming, our kids. We want to make sure that everyone has the same right to clean air, no matter what zip code they live in. So that's what's driving all of this work. And so the final thing I want to say is hoping everybody in this room is excited to keep this battle going in 2023, because it is our engagement that will make the difference. And so Lane and I mostly just want to thank you for being here and for being part of the Any other questions or anything else you want to say, Lane? Yeah.
I was going to just ask about the racial disparities and income disparities and the illnesses. Has that been broken down? I assume.
That's a good question.
Well, so it's different for different diseases.
Okay.
What I can tell you for asthma, because that's what I'm most familiar with, is that across the board in Massachusetts, the communities that have the highest asthma levels are gateway communities. That includes Springfield. Springfield was the #1 asthma capital in the country a few years ago because of problems with local access to health care and that concentration of pollution sources. So the Chelseas of the world, the Springfields of the world, Fall Risets, those passed, as we were seeing communities like Chelsea, really visibly overburdened, more so than other communities that are sort of more white, suburban, middle, upper class. There was a clear disparity between who was really taking it on the chin with COVID. And that visual picture helped us press for reform of EJ standards. And the Attorney General was a big part of that battle. Her staff did a study of incidents of air pollution and incidents of COVID and came out with, what we all kind of saw intuitively, that there are reasons why Chelsea and Lawrence and Worcester and Fall River had higher incidence rates for COVID, and it's related to the same reasons that we saw more air pollution in these communities. So it's a very good question. With asthma, it absolutely tracks, absolutely, that the gateway communities in this state, the low-income communities, have the highest asthma rates. All right, well, thank you, everybody who feels like they know a little bit more about air pollution.
Yeah, thank you.
Yay! Yeah. Who here feels like they want to fight for better air for Winthrop, for Chelsea, for East Boston, and our region? Yay! Our job's done then. Or actually, it's just beginning, isn't it? Thank you,
so much,
everybody.
Cindy and Lenny. Thank you.